Hello and welcome to your annual Right to Know and BloodBorne Pathogen training. If you have any questions about anything you see in this presentation, please don't hesitate to contact your supervisor or the Health and Safety Office at the Jefferson Lewis BOCES. We realize that some employees may not work with or even come into contact with chemicals on the job. Nevertheless, state and federal laws require all employees to receive chemical safety training on an annual basis. There are 3 laws or standards in effect that protect employees from hazardous substances. The first is the New York State or Right to Know standard. The second is the federal OSHA Hazard Communication Standard. And the third is an international standard called the Global Harmonization System or GHS. The New York State law, or otherwise known as the Right to Know law, requires that employees are made aware of the hazards in the workplace and that they're provided with information needed to work safely. Employers must post a copy of the Right to Know poster, and they must notify employees of their rights. If an employee requests information about chemical safety, the employer is responsible to get that information to them within 72 hours of the request. Employers must keep records of all Right to Know safety trainings. Information on the New York State Right to Know website refers additional information to be found from the federal or OSHA website. The next law or standard that requires chemical safety training is called the OSHA Hazard Communication Standard. This standard is in place to ensure that employers and employees know about workplace hazards and how to protect themselves, so the incidences of illness and injury due to hazardous chemicals is reduced. It's also in place because it provides training to minimize exposure and injury. The third standard is an international global harmonized system, otherwise referred to as GHS. GHS is concerned with the transportation, classification, and communication of chemical hazards, related via warning labels and safety data sheets that are understood universally. This presentation doesn't cover transportation requirements. So what do you need to know? There are 2 changes that all employees in general industry need to be made aware of. The first concerns changes to material safety data sheets, now referred to as safety data sheets. The second concerns chemical labels. Under the new GHS system, the word material from material safety data sheets has been dropped. All SDSs will now have a prescribed format consisting of 16 sections. And finally, districts in the MSDS online program through the Jeff Lewis BOCES are in compliance, but we suggest any hard copies that you have be replaced with new SDSs. GHS labels have 6 standard elements for classification of hazards. First, a product identifier. Second, the manufacturer contact information with name, phone number, and address. Third, a hazard pictogram. A colored picture is now required. Fourth, a signal word. Either the word danger or warning must be on the label. Fifth, a hazard statement. This is a standardized sentence that describes the level of hazard. And 6, a precautionary statement, which are steps employees can take to protect themselves. 2 sets of pictograms are included within the GHS. One for the labeling of containers for workplace hazard warnings. The second for use during transportation are not pictured. Workplace labels will now include pictograms with red borders, black symbols on a white background. Employers can make the transition to GHS easier by following a few key steps. These include inventorying chemicals, training employees on GHS formatting, labels, and SDSs, Plan for your entire library of current MSDSs to be updated in complying with the timetables listed here. Train employees on GHS formatting by December 1st of 2013 and expect to be in full compliance by June 1st, 2016. As previously mentioned, OSHA and the Federal Hazard Communication Standard ensures that employees are informed about hazards and that they know how to protect themselves. The Hazard Communication Standard includes 5 main requirements. A written hazard communication program is required in all occupational settings. All chemical products must be labeled, now with GHS labels. Employees must have access to SDSs for all chemical products. OSHA requires that employers keep records of all employees that work with any chemical that is on the Subpart Z chemical list. Some of the most common chemicals on this list include gasoline, motor oils, and ammonia. This entire list can be found at OSHA.gov. The most recent changes are those already mentioned, called the Global Harmonized System. The Hazard Communication Standard applies to basically all employees. Remember, the purpose is to keep everyone informed of chemicals in every workplace. To do this, employers must keep a written plan, maintain an inventory of all products, maintain safety data sheets, enforce labeling requirements, provide hazard awareness training. The New York State Right to Know law also requires the same training. Most recently, employers must stay current on GHS requirements. While it is true that schools are reducing the amount of dangerous chemicals in buildings, in general, millions of workers across the U.S. are exposed to potentially dangerous chemicals every day. Chemical exposure may cause or contribute to heart ailments, central nervous system damage, kidney and lung damage, sterility, cancer, burns, and rashes. These types of injury are called health hazards. In other words, injuries that occur inside or on the body. Chemical hazards that have the potential to cause fire and explosion are called physical hazards. There are 6 main chemical hazard areas. They are flammable and combustibles, explosives, corrosives, carcinogens and mutagens, irritants, and radiation. Part of the standards are to inform employees of their rights. Know that you have the right to any and all information concerning the nature and toxicity of substances in your workplace. You may refuse to work with any product if requested information was requested and not received. You may exercise your rights pursuant to the law without fear of discrimination. And finally, you may file a complaint with the Department of Labor if you feel you have been discriminated against. Employees have the responsibility to comply with all safety and health standards. These include reading labels and safety data sheets, follow all instructions and warnings, attend all trainings, and wear any assigned personal protective equipment for the job. You need to know, can a chemical hurt you, how it can hurt you, and how you can protect yourself. Routes of exposure are how chemicals can enter the body. When chemicals enter the body, it can happen either immediately or quickly, or more slowly and over a period of time. When it happens immediately and you smell or feel the effects, you've had an acute exposure. Sometimes the effects of chemical exposure isn't readily felt or noticed. Sometimes the effects can take years or decades to be known. This type of exposure is referred to as a chronic exposure. The 4 main routes of exposure to chemicals are through inhalation, absorption, ingestion, and injection. There are 5 ways to protect yourself from chemical hazards. The first 3 are in place before the employee even starts a job. First, controlling the hazards. This means that the work environment is changed physically to prevent employee exposure to potential hazards. Second, controlling the environment through engineering controls. Over the past several years, we've seen our school buildings make the switch to environmentally safe green chemicals. These products are less toxic, not only to the environment, but also to the workers. Administrative and work practice controls change how or when employees do their job. The last step to protect employees from any hazard on the job is by issuing personal protective equipment, or PPE. Remember, PPE is designed to prevent or lessen injury to employees. PPE cannot eliminate hazards. It is each employee's responsibility to use personal protective equipment correctly and responsibly. Employers are responsible to provide specific training to all employees who are exposed to hazardous chemicals in the workplace. Training must occur at the time of initial assignment and whenever new chemicals or hazards are present. Including in the training are an explanation of the hazard communication standard, hazards of specific chemicals, protective measures such as the use of personal protective equipment, and how to detect the presence or release of a hazardous chemical. So, where can you find information to protect yourself? First, on the label. The new Global Harmonized System simplifies container labeling. The label will include the product identification, either the word danger or warning, a hazard statement, a precautionary statement, the supplier identification, and a pictogram symbol to convey hazard information visually. Remember, portable containers must meet the GHS label requirements. The second place to find chemical information is on the safety data sheets. SDSs must be accessible to employees and must be in the 16-section GHS format. SDSs may be kept in a binder or accessed electronically through the internet or fax machine. As long as the employee has access, either method of storing SDSs is acceptable. Many schools in the Jefferson-Lewis Health and Safety BOCES service subscribe and are enrolled to an online SDS service called MSDS Online. With this service, SDSs are available 24 hours a day, 7 days a week. If your school is enrolled in this program, use the following procedures to access SDSs. First, locate the desktop icon that has been installed on your computer, or type the web address that is unique to our program into your internet browser. Because this is a program that is paid for by some districts and not others, we are not allowed to disclose this web address in this training or on our website. Further, if your school is enrolled, you are not allowed to make public the link to our MSDS online account. Once you are on the site, you will see the following screen. Tutorials are located that describe the program. Simply search for the SDS you are looking for. You can save and print SDSs and labels. In addition, as a group, we are allowed a certain number of phone calls and fax requests per year. In the event of an emergency, phone the toll-free number and request that an SDS be faxed to you within 5 minutes. Other ways to protect yourself from hazards include always choosing the least toxic chemical for the job. New York state law requires that schools must purchase environmentally sensitive cleaning and maintenance products, otherwise known as green products. Sometimes in the event of disinfectants, it is not possible to use green products. Always check the product's label and SDS to review the hazards if you are unsure. And remember, never bring chemicals into the school from home. When this is done, there is no SDS to accompany it. It may even be irritating or even dangerous to some individuals. Bringing products from home into a school may even be illegal. For more information on this program, contact your supervisor, safety officer, or the Health and Safety Office at the Jefferson-Lewis BOCES. Like the Hazard Communication Standard, the Exposure Control Standard requires training for employees that may come into contact with human blood and body fluids. Bloodborne pathogens are microorganisms that are found in human blood. They can cause disease. Diseases like hepatitis B and C and HIV, or human immunodeficiency virus. Bloodborne pathogens are spread when infected body fluids or blood are introduced into the body. Some of the primary ways that people become infected are when sharp objects pierce the body and introduce a virus into it. The body can become infected when a virus is absorbed into it through a mucous membrane like the eyes, nose, or mouth. Infections have occurred through blood transfusions, but the primary way that people become infected with viruses like hepatitis B, C, or HIV are through sexual contact or illegal drug use and infected needles. Before we talk about bloodborne pathogens, we need to mention hepatitis A. Hepatitis A is not a bloodborne pathogen. We mention it in this training because it is one of the most prevalent forms of a hepatitis infection. Hepatitis A causes mild liver inflammation and is highly contagious. The reason it is so easily spread is because the virus is found in the stool of infected people. If proper hand washing is not done after using the bathroom, people can spread the virus by contaminating food that others eat. The hepatitis A virus is more easily spread where sanitation conditions are poor. People at risk of contracting hepatitis A include those who share a household or have sex with someone who is infected, travelers to countries where hepatitis A is common and where clean water and sewage disposal are not available, those who eat raw shellfish harvested from contaminated water, people who use street drugs and contaminated needles, children and employees in care centers where a child or employee has hepatitis A. Symptoms of hepatitis A include yellow eyes, dark urine, tired or fatigue, loss of appetite, vomiting, and fever. A person can spread hepatitis A about 1 week before symptoms appear and 1 week after symptoms. There is a vaccination for hepatitis A, and prevention includes hand washing with mild soap and water for at least 15 seconds, boiling water at 185 degrees for 1 minute will kill hepatitis A virus, using a 10-to-1 bleach solution for cleaning environmental surfaces, and using personal protective equipment such as latex or vinyl gloves. Hepatitis B causes liver inflammation and can lead to cirrhosis of the liver or liver cancer. Hepatitis B is transmitted by blood-to-blood or blood-to-mucous membrane contact, through contaminated needles, through human bites, from mothers to babies at birth, and through sexual contact. Symptoms of hepatitis B include fatigue, joint pain, loss of appetite, yellowing of the eyes or skin, and dark colored urine. Symptoms may not appear for up to 9 months after being exposed to the virus. Hepatitis B is 100 times more concentrated than HIV, and the virus can remain alive for up to 1 week on a dried environmental surface. There is a vaccination for hepatitis B. If your job description says that you may come into contact with human blood or body fluids, your employer is required to offer the hepatitis vaccination to you. If you decline, you will be asked to sign a declination form. Later, you may change your mind and request the vaccination. In addition to the vaccination, prevention of hepatitis B includes hand washing, safe sex, not sharing personal items, using a 10-to-1 bleach solution for cleaning environmental surfaces, and using proper personal protective equipment. Some facts about hepatitis B are that the virus can survive for up to a week in dried blood. A teaspoon of infected blood can contain over 1 billion hepatitis B particles, and hepatitis B is 10 times more common in the United States than HIV. It is also estimated that 1 out of 20 people in the U.S. are infected. Hepatitis C also causes liver inflammation and can lead to conditions like cirrhosis and liver cancer. Hepatitis C is primarily contracted through sexual contact, IV drug use, or in a way that the virus enters the skin through injection. There is no cure or vaccination for hepatitis C. According to the National Institute for Occupational Safety and Health, hepatitis C is the most common bloodborne pathogen in the U.S. The reason: injection, drug use, and sexual exposure. Prevention includes proper hand washing, 10-to-1 bleach solution for cleaning surfaces, and using personal protective equipment. HIV is human immunodeficiency virus. This virus is not a disease. It can lead to AIDS because it attacks the body's immune system. HIV does not survive well outside the body, and there is no threat on contracting HIV through casual contact. HIV is transmitted through contaminated blood, blood-to-blood or blood-to-mucous membrane contact, contaminated needles, and sexual contact. Infected blood used in transfusions or infected organs donated before March 1985. There is no vaccination for HIV. According to the CDC, it is estimated that 1 out of 250 people in the U.S. are infected with HIV. So how do we reduce our risk? First, we identify potentially infectious material like blood and body fluids. Treat all blood and body fluids as if they were infected. This is called universal precautions. Next, through engineering or work practice controls, always wash hands with non-abrasive soap or use an antiseptic hand cleaner. Never eat, drink, apply cosmetics, lip balm, or contact lenses where there may be an exposure to blood. Don't share personal items, and dispose of sharps, broken glass, or blood-soaked rags in proper containers. And finally, use personal protective equipment. Always check PPE for defects or tears before using, and if your personal protective equipment does become defective in any way, dispose of it and get new. Remove personal protective equipment before leaving any contaminated area. And remember, never clean blood or dress open wounds without wearing gloves. You may have an exposure potential if you are exposed to accidents that involve blood, if you administer first aid, if you're responsible for post-accident cleanup, if your work is janitorial or maintenance, and if you handle any waste products that involve blood or body fluids. You can also reduce your exposure by immediately washing any exposed skin with soap and water for 15 seconds. Flush any exposed mucous membranes with water and dry with a clean towel. Keep your hands away from your eyes, nose, and mouth when there's an exposure to blood or body fluids. And report any exposure to your supervisor immediately, per your exposure control procedures in your exposure control plan. Your school district's exposure control plan includes training requirements, work practice controls, engineering controls, and procedures for exposure incidences. If you would like more information on your district's exposure control plan, please see your supervisor. If you have any questions about the bloodborne pathogen standard, visit OSHA.gov or call the Health and Safety Office at the Jefferson Lewis BOCES.